Hello, everyone, and welcome to the fourth Fibromyalgia Association Canada's Awareness Week presentation. I am Trudy Flynn, Chair of the Board of Directors of Fibromyalgia Association Canada, or FAC. Thank you very much for joining us. Although we come together from many different places, I would like to acknowledge that the land I live on is located in Mi'kmaq, the ancestral and unceded territory of the Mi'kmaq people. This territory is covered by the Treaties of Peace and Friendship, which Mi'kmaq and Wolastoqiyik peoples first signed with the British Crown in 1726. These treaties did not deal with the surrender of lands or resources, but in fact recognized Mi'kmaq and Wolastoqiyik title and established the rules for what was to be an ongoing relationship between nations. In Nova Scotia, we are all treaty people. So before I get started, I just wanted to cover a few housekeeping items. If you have any technical problems, please email webmaster@fibrocanada.ca. If you have any questions for Dr. Norman, please put them in the chat. We're pleased to provide captioning to accommodate the diverse needs of our audience. This presentation is being recorded for those who could not attend this live presentation and for our YouTube channel. We will be muting all participants to reduce the noise feedback. Now I'd like to welcome Dr. Norman. Thank you, Dr. Norman, for helping FAC educate people with fibromyalgia and for doing this presentation. Dr. Norman is a radiation oncologist with 7 years experience working full-time in the medical cannabis field. Areas of interest include fibromyalgia and other chronic pain syndromes, palliative care, mind, body, and trauma connections, cannabis science, including dosing and tolerance, terpenes, and minor cannabis compounds. I will turn it over to you, Dr. Norman.
Thank you very much, Trudy, for the invitation. Okay, so I'm also going to start with a land acknowledgement. In Newfoundland and Labrador, it's the ancestral homes of the Beothuk and the Innu and Inuit. I also just want to acknowledge the traditional knowledge keepers. We know about plant-based medicines because of the experience of patients and in particular the experience of people from across the globe, but a large body of knowledge from Aboriginal people in Canada. In terms of financial disclosures, I do get clinic staffing support and speakers fees from Cannabis and Emblem, and I'm a physician mentor with Cannabis Growth, which does Spectrum and Tweed. So I'm going to start out by introducing the two most common cannabis compounds. And then we'll get into some of the evidence and the reasons why these compounds work. So the two compounds most commonly used are CBD or cannabidiol and THC. And these are cannabis compounds that are found in the plant, in the female flowers. And they have very different actions, but they may be found in the same plant, or you may have a plant that is predominantly one or the other. From this plant, you can make it into an oil, which can then be used in edible formats. It can be used in topicals, and it can be inhaled. But the drugs themselves, the THC and CBD, stay similar throughout the formats. So CBD is commonly known for the fact that it does not cause impairment or high. There's good research on seizures, some on anxiety, inflammation, some other forms of pain sensation, and it may even have an impact on craving for other drugs. CBD is incredibly well tolerated. I will use it in just about everybody. And the side effects typically are dry mouth, acid reflux, and sometimes some problems with sleepiness or insomnia. At very high doses, such as we use in epilepsy, we do run into drug interactions, and there can be some liver enzyme abnormalities, which are thought to be related to drug interactions, and appetite suppression, but overall really well tolerated. THC is the compound in the cannabis plant most associated with giving a high. And what that means is the person can be relaxed, but some people actually feel very anxious with THC and can even trigger hallucinations or paranoia. And this distorted sense of reality rarely can persist in the form called psychosis. So even after the high wears off. But much more commonly, it's just a relatively gentle sensory intensification, increased appetite. Everybody knows the munchies. It relaxes the blood vessels, so you get red eyes, but you can also get a drop in blood pressure or an increased heart rate, which can be occasionally lead to fainting or be hard on the heart in somebody with heart conditions. Dry mouth, and of course, THC is the component that can make you impaired, uncoordinated, loss of sense of time, which is particularly an issue for driving, and it can impact memory, typically in a short-term way. But you don't have to get high to get help from cannabinoids, including THC. So the best pain relief usually combines THC and CBD with a higher amount of CBD, but also including the THC as well. And the presence of CBD and other plant compounds can reduce the side effects of THC, particularly anxiety. And with THC, we recommend microdosing. So taking a small amount, almost too small to be sensing it, and working your way up gradually. If you overdo THC, the first thing to know is that you cannot overdose on it in the sense of suppressing respiration. But there are consequences to using too much or too often. One is that it does activate the reward system in the brain, and dopamine is the chemical that causes us to pursue things in life. And if you deplete it, it can affect motivation. Your brain can adapt by reducing the number of receptors where the THC would interact with the cell, and that can trigger withdrawal, which is kind of feels the opposite of what people look for in cannabis. So anxiety, insomnia, irritability, low appetite. And there are some weird ones like cannabis-induced vomiting, which is associated with abdominal pain and relief by hot showers. And that's typical in somebody who's smoking multiple grams a day. And the only treatment for it is stop using it. So why do we use THC if it has more side effects? Well, it's effective on a number of different types of pain. So in particular, it reduces nerve pain and muscle spasm by blocking overactive nerve firing. It does have some impact on inflammation. And the effects of the brain can also be helpful. So focusing the attention elsewhere, memory and nightmare suppression, appetite and anti-nausea effects, and some areas that are currently being actively researched, such as neuroplasticity, or how the brain gets rewired to learn new things. There's a growing interest in psychedelics in general, and we'll touch on that later. And the other advantage to using THC is that it works in very small amounts, which reduces both the drug interaction issues and the total cost. So the evidence for using cannabis in fibromyalgia remains weak. It's illegal to study positive benefits of cannabis in most US universities. And it's also hard to do randomized controlled trials with something that you can feel. So we mostly have case series or very small randomized controlled trials. There have been no randomized controlled trials of CBD in fibromyalgia, which is really unfortunate because it wouldn't be hard to do. And some of the newer cannabis compounds, we don't even have safety or clinical data on. So as we know, Canada was one of the countries that's had medical cannabis for a long time, and Israel even longer. And in Israel, you have to be registered centrally with the government. So they're able to do case series. They looked at 367 patients with fibromyalgia. A little less than half used cannabis for their symptoms before. And they were authorized to use up to a gram a day, which is relatively on the low end of the dosing. And they could use any form of cannabis that they wanted. So they had questionnaires completed at 6 months for 70% of these patients. And this is a typical pain out of 10 scale. And you can see that the majority of patients had 8 or 9 out of 10, or 8 to 10 out of 10 pain at the start. And after medical use of cannabis by 6 months, the most common pain score was 4 or 5. And the quality of life shifted from the red areas of very bad to bad, to a much larger percentage having a good quality of life. Sleep was a common complaint and was improved in the majority of patients. And there was also improvements in depression symptoms in a large number of the patients. This survey is a US survey focusing on CBD product types. And they were specifically looking as to how often CBD, the non-psychoactive cannabis compound, could be substituted for medications in fibromyalgia. Again, with surveys, the people who do well are more likely to answer the survey, so it does have some bias, but it's interesting to compare the different compounds. So they looked at 3 different classes based on how much THC was in them. So a CBD isolate means that they've chemically stripped out every other compound besides CBD. A hemp product contains other cannabis compounds, but very little THC. And CBD cannabis would be a higher THC, and that's what we're used to having in Canada. So for example, a ratio of 20 CBD to 1 THC is really common. And that would have fallen in this 3rd category. They did not separate out inhaled and topicals and oral. So we'll see that there's a mix of products being used. So they compared how likely were people to get rid of their medications. And if they took the CBD isolate and counted that as 1, then in comparison, hemp was 1.67, so about 2/3 more likely to get rid of medications. And with the CBD cannabis, it was over twice compared to the CBD isolate alone. So the plant compounds often work well together, and this was demonstrated in this survey. However, they also were more likely to include inhaled in people who were using CBD cannabis. So what kind of medications did people get rid of? Remembering that this is a somewhat biased response by who would choose to fill out the survey, but they saw reduction in medications across the board. So half of people stopped using opioids or sleeping pills or anxiety pills. Anti-inflammatories, people tended to use less of them. Antidepressants and gabapentinoids or drugs like Lyrica. So this is a big part of my practice, is not only guiding people with using the cannabis, but in reducing their other medications. And the final paper is a very small randomized control trial. But I like this because it used oral THC, but at very low doses. And here we have the Fibromyalgia Impact Questionnaire. Everything towards the axis where all the labels are, that's good. So even though it says feel good and depression, it's still all good in the same direction, okay? And so we see that the patients after 8 weeks on an average of only 5 milligrams per day of THC, they were showing improvements in many different fibromyalgia symptoms, including sleep, energy, ability to work. They did not see an improvement in mental health, and especially in anxiety. And I suspect what that was is that some people, their anxiety improved, and then we have that about 10% of people where anxiety gets worse with THC. So on average, it didn't change. So how do I, with the experience that I've got, approach introducing cannabis for somebody with fibromyalgia? For reasons I'll explain in more detail later, I recommend that you take it by mouth. That can be oils, capsules, edibles. No big differences between those. I don't think there's magic in the magic gummy bears. The reason I use that rather than inhaled is it's longer lasting. Your symptoms are there all the time. We want relief to last a long time. It's less costly in the long run. Almost universally, people who use inhaled will end up paying more, even though the products look more expensive by mouth. And that has to do with how the body adjusts to it. It's less addictive. And I used to be a lung cancer specialist, and it kills me to have people putting things through their lungs. So how do you dose it? So I start with 6 weeks of a CBD by mouth. And that can range anywhere from 10 to 50 milligrams once or twice a day. So anywhere from 10 to 100 milligrams, but most people are 20 to 40 milligrams a day. How do you figure out how much is a milligram? Well, if you've got it in an oil, that's probably the most difficult, because you have to know that milligrams per gram is actually milligrams per milliliter, within plus or minus 3%. So if you had a 50 milligram per gram oil and you wanted to take 25 milligrams, you would take half of a milliliter. So the reading on the syringe would be 0.5. Even worse if you're using a spray, because it doesn't even tell you that one spray is 0.1 milliliter. It's one of the places that edibles is better because it's easier, as the package says. So in terms of how often to take it, I start dosing once a day. And if you get a good result, but it wears off after 8 hours, dose it twice. You can take the whole 20 milligrams in the morning and the same 20 milligrams in the evening. In terms of how close to put it to bedtime, some people find CBD helps their sleep and sometimes it worsens sleep. And there was a question about which CBD brands do I use when I want certain characteristics around sleep or energy. There's one brand that I use for energy called Afria. You definitely don't want to take that one close to bedtime. And there's one that I use when I want to treat insomnia and I don't want to use THC, and that is Spectrum Yellow. And then everything else seems to fall in between those two. At the 6-week mark, if sleep is still a struggle and the person is an appropriate candidate, they don't have a history of the family history of psychosis, they're not too elderly or have heart disease or things where THC can be harmful, then I will add in one of these 3 compounds: THC, CBN, which is like THC, but just a little gentler in terms of impairment, or nabilone, which is a synthetic from the pharmacy and is covered under insurance and workers' comp. When we're using THC, I do prefer indicas. I want you to be into couch. I want you to be relaxed because they're high in plant compounds that don't make you impaired, but do help with sleep, like myrcene, and also tend to be higher in beta-caryophyllene, which is anti-inflammatory. And whether to use CBD at night depends on the person. I'll often start them in combination and then end up separating them out if I'm not getting very good sleep response. But the most important thing is to keep the dose low. So you can see THC benefit in as low as 1 milligram, which would be the amount that comes in your CBD. I do tend to try and limit it to 10 milligrams because I don't want people's abilities to be affected in the morning, and I don't want them to build up tolerance so that they need more and more and more over time to do the same job. It does seem that around 10 milligrams is where those things start to change. The other thing is that cannabis is a funny drug. If you take more of it, sometimes you actually get less pain relief, as well as more side effects. All right, so the next step is that we're going to look inside the body to talk about why these medications, cannabis-based medications, are working. So inside your body, you have an opioid system called the endorphins, and you have a cannabis system called the endocannabinoid system. Endo means within, and cannabinoid means from the cannabis plant. Its job is to chemically balance out other systems, especially around eating, sleeping, relaxing, forgetting, healing. It is a fine tuner. This is not a system that makes dramatic changes. This is a system that chemically keeps things in balance. So if you have too much inflammation, it'll calm it down. If you have too much cell death, it'll help to protect the cells. If you don't have enough cell death, it'll actually push them to die more quickly. But it's generally a fine tuner. And as you can imagine with this image, if you give this image a hard shove in one direction, you're not gonna get very good results. So we start low, to save you money, to make the system work better, and to keep it working. So what kind of things do we fine tune the chemistry for? Brain development, both in childhood and also in learning or revamping the brain, learning and memory, the immune system, which is directly related to inflammation, gut function, mitochondria, which are the powerhouses of the cell and are very important in energy, even bone development. Lots of effects in the brain in terms of pain, psychiatric disease, movement, sleeping, and regulation of stress. But it's important to recognize that when your body is using this system, we're going to make them when and where we need them. When you use something like THC, the problem is that you're going to get effects in all of these areas. So the endocannabinoid system is involved at many points in creating, extinguishing, and sustaining pain. So the first one, it has to do with nerve firing. So when a nerve has fired, there's an electrical signal that comes down the part of the nerve called the axon, and it will get to the gap between it and the next nerve cell. In order to cross that gap, it releases little balls of neurotransmitter, and that'll cause the next nerve to fire. So the body's endocannabinoids will also be released when this nerve is fired, and they go backwards to the first nerve and interact with the receptors there so that it doesn't keep firing. Okay, so the endocannabinoids' job is to stop a nerve that's fired once from firing again too soon. If you think about something that stops nerves from firing, you would expect it to be very drowsy, very impairing, just generally push down the function of the nervous system. But that's not what happens with cannabis. In fact, thoughts may be more jumping from one place to another under the influence of THC. So why does that happen? Well, some of the nerve cells in the brain will cause other nerve cells to be more active, and some will cause other nerve cells to be less active. And the balance between these is part of why the effects of cannabis don't seem to just go in one direction. Overuse of cannabis can tip the scale, and especially overuse frequently. And in fact, you can actually temporarily harm your own cannabis system as the body tries to adjust and rebalance by making less places for the cannabis to interact with the nerve cells. So that's nerve firing. The second place that it's involved is in inflammation. So what is inflammation? Well, if you think of a boil, that is classic inflammation. We have pain, heat, redness, swelling, and stiffness. And some patients with fibromyalgia, if we test for inflammation, they don't have very much inflammation. They have pain for other reasons. But some people do have inflammation, either as part of their main condition that then led into the fibromyalgia, or just because lots of people have arthritis. Why do we have inflammation? Well, why can't we just shut it all down? Inflammation is there in order to fight off infection primarily, and to prevent a body part that's injured from being overused. But the inflammation is also causing some direct damage. How does cannabis interact with inflammation? Generally towards suppressing it. Okay. So we want to suppress the excess inflammation. We don't want to suppress the immune system itself. So CBD works by reducing the chemicals that are called cytokines. And you may have heard of this with COVID. Cytokines are chemicals that will call in the immune system and hype it up. So CBD reduces the release of these cytokines. THC will interact with receptors on the immune cells, and that's part of how it tells it not to release more cytokines and not to gather more immune cells into the location. And there's another cannabis compound called beta-caryophyllene. It's what's called a terpene. It's found in some strains of cannabis, and it also works directly on those receptors in the called CB2, which are the cannabis receptors on the immune cells. Okay, so number one is pain transmission through the nervous system. Number two is immune function. And number three is something called central sensitization. And this term was new to me when I went into cannabis practice. And it can easily be confused with pain tolerance. So we now know that pain actually takes place only in the brain. You can have a cause of pain in the body, but the pain itself happens in the central nervous system. And it is a combination of sensory and emotional experience that may or may not be associated with potential tissue damage. So I described it as the harm alarm or the fire alarm in the brain. Central sensitization is anything that causes the nervous system to respond to signals that should not cause pain. And that can happen on the basis of wiring, of how the neurons are connected, chemistry, and psychology. So this would be when your fire alarm goes off when you make toast, as opposed to your fire alarm going off when you want it to, when there's actually a smoke or a fire. Well, the number one cause of central sensitization is poorly managed pain. So the repeated nerve firing causes those connections to fire more easily over time, and they can actually get cross-wired. So the pain can be learned by the nervous system, and by learning, I mean it got better with practice at making more pain. Because chronic pain is repeated over and over, and nerve cells that fire at the same time can get cross-wired. And once that happens, you can activate it from either end. So you can have your pain giving you anxiety, but if you fire off the anxiety portion of the brain, you will trigger the pain as well. The other thing that causes wiring to happen on a much faster basis is trauma. And it tends to make it less specific or accurate as well. In other words, you learn for two things to be connected, even if they're not really connected. So pain can get cross-wired to anything that reminds the brain of the injury. So position, for me, head down and looking at the phone, because that's how I was when I got hurt. Physical location, driving over a bridge, visual signals, mood states, and anything you think, what did I do wrong? So we think that some of the pain sensitization with, sitting in the wrong kind of chair, or changes in the weather, which is a terrible one in Newfoundland. Whatever it is, if the brain thinks that's the answer, it will start to make the pain worse whenever that trigger is there. And the pain is going to go off earlier and earlier in an attempt to keep you safe. So if I've injured my arm with really overreaching, now when I move my arm and I'm doing no damage to the arm, but my brain thinks she's going to do that move again, it'll send off the pain earlier and earlier. So with central sensitization, the nervous system can't tell if there's a stimulation that should be okay or damage. The fire alarm goes off regardless. Pain tolerance is the ability to put up with the fire alarm when it goes off. Central sensitization is how easily the fire alarm goes off. This can get confusing because some of the things that lower pain tolerance can also cause central sensitization. Fear is a funny one. If you're afraid for yourself, that tends to make pain worse. If you're afraid for someone else, it tends to make the pain better, so that the mama bear can chase off what thing she needs to chase off. A lot of social stressors, lack of sleep, sensory overload, too much going on. And it also matters when these things happen, because adverse childhood experiences are more likely to get hardwired into the brain that is still growing. So coming back to tolerance, that's putting up with the fire alarm. Many patients will tell me they use cannabis. It doesn't really help their pain. For them, it helps them tolerate the pain. And that can certainly be useful. You need sleep. Sometimes you need distraction. But if you're using especially smoked cannabis or vaporized cannabis, or if you're using opioids to do the same thing, the problem with both of those is the dose to have that distraction tends to go up and up and up. There's also some chemical things that you should know about that can trigger off this central sensitization or broken fire alarm. Too high a dose of either opioids or cannabis can directly worsen widespread pain at the time. Withdrawal of these same chemicals can also worsen that widespread pain. And not having enough chemicals that are involved in mood, like serotonin or norepinephrine. There's some diet deficiencies. There's exposures to toxins. But the most common thing, again, is untreated pain. So one of the things that happens besides this rewiring, because the two neurons have fired together, is that there are cells within the brain that are constantly checking on the state of the nerve cells and either nourishing them, or if they're damaged, taking them out. And it does that through a process called neuroinflammation, and the cell involved is microglia. So I first heard about this last year, and I thought, I bet you that this is connected to the cannabis system, and lo and behold, it is. So microglia can be in a state where they're inflammatory, or they can be in a state where they're anti-inflammatory or neutral and just checking things out. So besides drugs, probably the best thing that has been shown to impact neuroinflammation and rewiring of the brain is exercise. So exercise, it should be thought of as a prescription like a drug, because it reduces this central sensitization over time. It prevents you from losing gray matter in losing brain cells in the area that is affected by pain. And it seems to be more effective when combined with mindfulness or breathing practices, because you're signaling to your body's system that you are safe. It increases endorphins, which is your body's own morphine, and the receptors for it, and it increases the endocannabinoids. And in addition, if you make your back stronger, it's less likely to hurt. Okay. This is the last quarter of my talk, and before I get into giving you more information, I just wanted to check in. Were there any new questions that had come in, Judy, where people are like, what did she say there?
No, there is nothing in the chat, but once again, I encourage anyone to put any questions they have for Dr. Norman in the chat, please.
Okay. All right, so we've talked about THC and CBD, and if those are the only two that you remember, great. That is what I use 90% of the time. But here's some other cannabis compounds. So there is a prescription medication called Nabilone. It mimics THC, so it's going to have the same sort of side effects. It's developed for cancer patients, but it's most commonly used for chronic pain. And I find that the difference between Nabilone and oral THC is that people report being just mentally dulled more on Nabilone. It does seem to be less likely to trigger anxiety than THC. So the main advantages are you can travel with it internationally. You cannot take cannabis outside of Canada, but you can travel with it otherwise. And it's covered by insurance and workers' comp. And so that's important for some people. So this synthetic has been shown to be safe. And that's partly because it works mostly like THC, and it doesn't hit those receptors too hard. There are some other synthetics available on the black market, especially by the name of K2 and Spice. And there was a drug that was developed by a pharmaceuticals company called Ramonabant. All three of these you should not touch. Delta 8 THC you may run into in the States because they're chemically making it from hemp. There's not much safety data one way or the other. And these compounds, because they strongly impact the receptors, there has been deaths, either due to contamination or due to how strongly it activates the receptors. It can trigger psychosis, so that's loss of touch with reality that persists. It can trigger seizures, kidney failure, and cannabis is so readily available these days. Why would you mess with synthetics like this? It's not the fact that cannabis is a natural plant that makes it safer. There are lots of natural plants that are very dangerous. The opium poppy, cocaine, tobacco, these are all things that are natural and not good for you. But the cannabis system, because the system is based on fine-tuning balance, tends to be a system that is kind of hard to screw up, which is a good thing. CBG promises to be my next new favorite cannabinoid, but unfortunately, I don't have enough safety or effectiveness data just yet to be using it widely. It is another non-impairing cannabinoid, and it's always been present in hemp and higher THC cannabis. It is the first thing that the plant makes, and then it converts it to the THC and CBD. And it looks promising for anti-inflammatory. reduce skin sensitivity for pain, which is where I'm using it right now, a lot of topicals, and I've been very impressed with it. Involved in bone healing, anxiety, protecting the nervous system. It does give you the munchies for good or for bad, but and it also tends to work at lower doses, so it may be a bit more cost effective. So the easy way to remember it is kind of halfway in between THC and CBD, and it's something to keep an eye out for, but you may not want to be the guinea pig. CBN is another, or cannabinol is another compound that's always been around. If you leave cannabis exposed to the air for 6 months to a year, much of it converts to CBN. CBN itself is not very impairing, but when you combine it with THC, it can actually give a more calm, but more psychedelic experience. And it's active at that CB1 receptor in the brain and the CB2 receptor in the immune system, but has more immune system effects than brain effects. The effects of CBN are calming, sleepy, reduced pain sensitivity. Again, we're lacking the safety data. Unlike THC, we don't have a couple of million users to look at the long-term outcomes. I also will sometimes use a fresh cannabis flower. This, of course, is not a cannabis flower, it's just a leaf, but you can brew it into a tea, and the compounds that get into the tea have very little high to them. Well-absorbed, anti-inflammatory, anti-nausea. Very hard to study in the lab because it easily converts from THCA, which is the raw form, to THC. And it's confusing because you're getting both effects. But it may increase the benefits of THC without doing much for the side effects. I really like creams and topicals for both skin and muscle effects. I will warn you that things that are labeled transdermal can make you high. I've put a lot of emphasis on oral cannabis in this presentation, but if you are going to inhale it, the safest way to do that is a dryer vaporizer. This is a machine that gives you enough heat to get the THC, CBD, beta-caryophyllene, all the good things that you want to go into vapor, but it does not light it on fire, so there's much less cancer-causing chemicals generated, carbon monoxide, tar, all those things that make smoking bad for you. Another area that I think we're going to move forward into is psychedelic assisted psychotherapy. So we know that cannabis is a borderline in terms of being classified as a psychedelic drug. And psychedelics in general are very exciting research coming out because they seem to make psychotherapy work much better. So it's different if you take a psychedelic and have a laugh with your friends or watch a silly movie than spending several hours with a therapist exploring your emotional experiences. The psychedelics are interesting because they give you a sense of safety. They directly impact how malleable your brain is in terms of making new connections between neurons. They can give you new insight. So you might have been stuck in the way you were thinking and now have a new way to look at something. And they encourage people to learn how to heal themselves, which people tend to continue to do even after the therapy and the psychedelic are finished. So cannabis has not been studied yet, but I have seen the direct effects that strongly suggest to me that it could be used in this way. All right, it was between this cartoon and Mrs. Can I go now? My brain is full. I wasn't sure which one to put up. So I know it's a lot of information and I'm looking forward to the questions.
So we do have one question in the chat, and that is from Charlene. She said, this may be too personal, but I thought I would send along just in case. Many physicians, in my experience, are reluctant to prescribe cannabis. As such, I have done some experimentation on my own without success. My goal is to reduce my daily use of amitriptyline, currently 35 milligrams a day, by half. What strain, combination, dosage would you suggest I start with? I also have Crohn's disease, IBS, anxiety, and panic disorders.
I think you're a good person to get some individual directions, because the answers for some of those contradict the answers for others. I would still try the CBD by mouth first, but with Crohn's disease, you may see a reduction in diarrhea, you may see a worsening in diarrhea. I would stay away from sativas and THC alone because of the history of panic disorder. We don't want to trigger that off. Apart from that, what I said in the talk, 6 weeks of CBD, and then add in microdose THC, 1 milligram at a time.
Thank you, Dr. Norman. Is there a person that could guide you through a healthy regime for using cannabis? So, for example, the type you should use, how often, possible medication interactions, when to use, and if there is a regulated specialist that helps with the monitoring and direction of use, people with fibromyalgia would benefit from that should they choose to use cannabis for treatment.
Yeah. So I think that if your intent is medical and you don't get perfect results kind of right off the bat, then guidance of somebody who has a lot of experience with medical cannabis is very helpful. There is no specialty, but there are lots of physicians who've chosen to focus their area on cannabis. Very few of us will do it full time, but there are a number of medical cannabis clinics out there, I think that if your own family doctor or psychologist or psychiatrist says, yes, I've seen people benefit from this, but I just don't know enough, that reaching out to somebody who does it as regular practice makes sense. And the physician visits should be covered. If they're charging you money, that's a warning flag.
Thank you. So another question is, for travel, is there a method to move from CBD to nabilone?
So CBD and nabilone do not do the same things. I start with nabilone at night, but you have to be aware that nabilone is just as impairing as THC. And so if I know my patient is going traveling, I will give them a prescription for the lowest dose nabilone that's available, and I get them to try it out before they go. The other hint for travel is that you can actually build up your CBD before you leave. So for 3 days before you go, I tell people to double their CBD dose. And then it takes about 3 days to really wear off. So you kind of have this little window for getting to where you're going.
Thank you. Is there a strain that helps with energy and a strain for pain reduction?
There are a lot of strains that are useful for pain. I tend to look for ones that are high in myrcene and beta caryophyllene. If you don't have that information, just generally indicas tend to work better than sativas. And I don't have a lot of success directly providing people energy. But if you're sleeping better, if you have less pain, I think, those things help. My go-to CBD strain for energy is a Freya, which is available from a company called Tilray. It is not the most calming. That makes sense.
Okay, thank you. Are cannabis treatment side effects better, worse, or the same as traditional medication treatments for fibro?
So again, if your symptoms are controlled, that can go a long way. So I don't want people to give up medications that are working well. CBD generally has less side effects than a lot of medications. And THC, depending on the person, the dose, can have more side effects.
Okay, thank you. Can you clarify the aphasia product you discussed regarding CBD? I've been having trouble finding the right product.
Yep, it's Aphria, APHRIA, and it's sold by a company called Tilray.
Thank you. Also, I've heard there is a fiber CBD patch. Can you tell me if this is a good product and available in Canada?
It was available from Cannabis by Shoppers, but then they went under. So I'm not sure who has the patch anymore. Very little experience with it, can't comment, seems kind of expensive.
Okay. What is your opinion about purchasing CBD in the country you are traveling to?
First of all, make sure it's actually legal. Secondly, you want to have a product where you can have what's called a certificate of analysis. So if it just says CBD 200 and doesn't tell you any more information, be cautious of those. And within the states, it's important to know you cannot cross state lines. However, hemp-based CBD products may be mailed ordered. And one of my favorite ones within the US is called Healer, HEALER. But there's big problems with like in Canada, everything that's sold in the government stores is tested. In the States, it's a bit of a wild west, and products have had things like way more or way less of THC or CBD, or not even had any, at all. So we're lucky in Canada.
Thank you. For fibromyalgia people who continue to work, can they take cannabinoids while working?
It depends on what you do, and it depends on what you take. So it is always the employer's prerogative to say, no, this is safety sensitive work, and we have a standing policy, there's no cannabis products at all. And unfortunately, can't do much with a company that's decided to do that. In terms of the functional, like, do I feel people are safe to work? I drive and work on the CBD with 1 milligram of THC every day. And the effects of THC, I think, are similar to the effects of a lot of other medications. For example, the amitriptyline. Both can leave you not at your sharpest the next day. But there's more stigma around cannabis. Some companies will make exceptions if you have a medical authorization. Others will say that it doesn't matter. Their rules are their rules. So know your policy.
Okay, another question is, which form of cannabinoids is more efficient, spray, pills, or smoke?
Smoke tends to be the least efficient in the long run because the body adapts to the highest dose 5 minutes after you take it. Sprays are slightly faster onset than oils are, and capsules can reduce some of the gut side effects, but they are the slowest onset. And the gummies seem to be somewhere in the middle.
What CBD THC ratio would you recommend?
I usually start with 20 to 1 approximately. And it depends on, so if CBD interferes with your sleep, then you may want to separate THC out separate, like have them in separate products. Otherwise, anywhere from 1/3 to 2/3 CBD for an evening product would be pretty common. But I'm open to whatever works for the person. But generally, if you're going to call something CBD, it's not an equal number. It's like 20 to 1.
Okay, and is there a different ratio for pain versus sleep?
Tend to use more THC for sleep. And by more THC, I mean it might be equal, 1 to 1, or it might be just THC alone. And some people don't find that CBD does anything useful. And if we've tried it out for 6 weeks and seen no improvement, I have no problem with people not spending money on it.
Mario said, I was recommended 1 to 1 to help with the pain and sleep dysfunction.
Yep. Yeah. So that's a pretty common, let's have enough CBD around to reduce the anxiety side effect. The problem with 1 to 1 is that if that's all you're using, you're not getting enough CBD in the day. So if you have a CBD in the morning and a 1 to 1 at night, perfect. If you're trying to do everything with a 1 to 1, you're not getting the full benefit of the CBD.
Okay. Can you comment on storing cannabinoids to prevent unintended harm to children?
Same way that you would do with medications. The worst for that is candies. And they try to make the packages difficult for children to get into. I don't know, children seem to be better at these packages than adults. And you can open any of them with a pair of scissors. So if you really have that kid who's going to go looking, I would not have candies in the house, or I would put them in a lockbox. As somebody who had their first cannabis sampling at age 5, because grandma's brownies were not well hidden, it is a real issue, and there have been kids who've ended up virtually unconscious in the emergency room. So,
is there a medication that can be given for travel to replace CBD?
no.
Yes, we're stuck in Canada, right?
Apart from all the things that you would normally consider for, so if you're using for anxiety, there's a variety of anxiety medications, but There is no direct comparison.
Okay. So there are many cannabinoid suppliers. How can you access high quality and safe consumption?
In terms of safety, we're lucky in Canada. The products are regulated to be, free of contaminants. The biggest issue is don't overdose the THC. In terms of what company is the best, I've given a couple of examples, but beyond that, I think there's a wide variety of what people find effective. I look at price when it comes to CBD. I don't want an isolate because I showed you that paper where they don't work as well. The only people I use an isolate for are those who have drug testing at work, because we think it will pass the drug test. Or somebody who has a lot of gut symptoms with THC, because isolates sometimes are better tolerated. But, there's a variety of products and many of them work.
Okay, thank you. Is there any more questions from the audience? I don't see any. Thank you very much, Dr. Norman. This has been very informative, and I'm sure we'll have many viewings of this recordings because so many people ask for this information. So thank you very much.
Thank you for inviting me. It was great.
Thank you everyone for attending.